All right, so I decided to go ahead and break this one up into 3 recordings just to keep them from being so long and losing our attention. So now that we went through all the systems, now we can focus on how all that relates to nutrition. All right, so focusing now in section 3.9 more about the microbiota. We mentioned this a good bit already. All right, so these bacteria are kind of referred to as colony forming units, or CFUs. So in the stomach, because of the pH, it kind of limits the growth of these. But once we get into the small intestine, it goes from about 1,000 to about 1,000,000 of CFUs per gram of content. So there are a lot of bacteria. And then that even further increases as we get into the large intestines, which is where the majority of them reside. So we mentioned a couple of these before, but probiotic just means these are the microorganisms that have positive effects on human health, and some of them can be consumed, or if they're consumed in sufficient quantities. So we're seeing more of this advertised in like health food stores or in different foods, like yogurt is a probiotic because it contains living organisms, microbes in it that are known to help have health benefits. Then prebiotics, these are different ingredients that help those microbiota to grow better. So it's nutrients essentially for the bacteria in your stomach, not just for you. Then symbiotic, this is a combination of the pro and the prebiotics that are taken to provide some benefits to the host. And then there are also postbiotics, and these are byproducts of the microorganism. So not the bacteria itself, but things that they make that can then essentially, so instead of having the bacteria, you're just having what they make that helps you be healthy. All right, so again, just kind of looking, again, some examples. So prebiotics, again, foods that nourish the bacteria. So they offer minerals and nutrients that the bacteria need. The probiotic is actually the healthy bacteria that are in your gut. And the postbiotic are things that they make, metabolites, that would be useful. So some of the sources are listed down here just to give you an idea of these 3 examples. All right, so essentially they have some immune function to them. So kind of the healthy gut microbiota has been shown to be crucial to the immune system. It even gets its own, or has a role in what's called the gut-associated lymph tissue, or the GALT. That's very important in the immune system. So much of this is in the large intestine, but exposure to microorganisms promotes the maturity of those immune cells. So having those healthy, good bacteria help that immune system in the gut to be more active and work better. So then those beneficial strains of microorganisms directly compete and then reduce the activity of the pathogens, the one that cause disease. So not only do they provide kind of health benefits, but they also protect us from the bad ones. So just kind of this idea of the hygiene hypothesis. So the tendency to sanitize every surface and to treat every infection with antibiotics actually decreases exposure to a diverse community of microorganisms. And so essentially what's being found is that while all good intentions, a lot of the like using hand sanitizer all the time, or parents who are over kind of sanitizing to keep their kids from getting sick, it's actually causing an understimulated immune system, and it becomes sensitized to harmless things. So it increases allergies and all of that, and even to beneficial bacteria or autoimmune diseases. So because of this kind of over sanitizing or overuse of antibiotics, our immune system isn't getting kind of its natural stimulation, and it's actually causing more harm than good. So actually being too clean might actually make us more likely to develop allergies and autoimmune diseases. So the adage, a little dirt won't hurt, is kind of what goes along with this hypothesis. All right, so now if we look at some of these nutrient storage capabilities. So the human body, we need to reserve and maintain nutrients. So again, some come in, but we need to kind of have a storage facility for them. So fat is stored in our adipose tissue. Glucose gets stored as glycogen, one of those complex carbohydrates. So that short term is in the muscle, in the liver, and then the blood maintains kind of small reserves of some glucose and amino acids, but long term, carbs are stored more in the liver and the muscle cells. Vitamins and minerals vary in where they are stored in. For vitamins, again, if they're water soluble, it's hard to store those, so we need constant amounts of them. So balanced diet is safest. The safest means to get all of these. So again, we can maintain and kind of can store some of them, but constant balanced diets is what's key. All right, so if we kind of look at your nutrition and health, so some of the common problems that we see with digestion. So heartburn, and I'm sure you're familiar with probably all of these, but about half of North Americans experience occasional heartburn, or also called acid reflux. And this essentially occurs whenever the stomach acid gets back into the esophagus. Remember that sphincter that prevents things from flowing? Well, that acid in the stomach kind of erodes the lining then of the esophagus, and it causes pain, nausea, gagging, coughing, or hoarseness. And this is also referred to as gastroesophageal reflux disease, or GERD. And now this is only present whenever there's recurrent, and it's in a more of a serious form of this. So again, essentially what's happening is that esophageal sphincter there that's supposed to protect and prevent anything from the stomach from getting back into the esophagus, it kind of loosens and it lets some of that acid get in to the esophagus. It destroys some of the cells there and inflames the esophagus to lead to that burning feeling. Ulcers are also possible. There are a few different causes of ulcers. Some are caused by a bacteria called Helicobacter pylori. But then again, increased acid can also kind of eat through the lining of the stomach, and that causes the ulcers to occur. Again, the common causes, again, acid, but also an infection of a bacteria called Helicobacter pylori. And then also overuse of NSAIDs, so like aspirin and ibuprofen, they increase acid production, so then that can, as a secondary effect, can cause some ulcers. So treatments, if it's from a bacterial infection, so using antibiotics to treat it, otherwise just blocking acid production to decrease the acid in the stomach. All right, so nutrition recommendations for individuals that are prone to heartburn and ulcers. So again, healthy body weight helps. Eating small, low-fat meals is good. It decreases acid production. Limiting caffeine, which increases acid production. And then avoiding foods that worsen symptoms. So anything acidic, again, you're just adding more acid to the problem. So these are things like coffee, orange juice, tomato products. They're all acidic. Avoiding spicy foods. Again, same kind of issue. Carbonated beverages can also be decreased, as well as onions and garlic can increase that acid production. So eliminating those or decreasing them as well. As far as treating them, there are proton pump inhibitors. So protons are hydrogen ions, and hydrogen is what's related to pH. So by inhibiting essentially the release, so it prevents the gastric cells from releasing hydrogen ions. Here are just some examples. I would not ask you what those are on a test, but just so you're kind of familiar as you see them or use them, what they're doing. There are also histamine blockers. Histamine has a couple different types of receptors. H2 is one of them. So by blocking those receptors, it prevents histamine, which causes acid to be made. So by preventing acid production, again, it helps decrease the acidity. Again, just a few examples of some of those that are available as well. Moving on now to another condition, so constipation. So this is just defined as difficult or infrequent evacuation of the bowels, so elimination of that feces. So again, increasing fiber is really important here to give that bulk to help increase and keep the flow occurring. Drinking lots of fluids, especially water, having regular bowel routines, relaxing, and exercise is really good at promoting and increasing the movement through the bowels. And then if those don't work, laxatives can also be used. Again, they're not meant to be long-term, but can kind of promote that as well. Right, next talking about hemorrhoids. These are small or swollen veins that occur on the rectum and the anus. They're also called piles. I've never heard them called that, but they can. So this is caused by intense pressure. So again, having healthy routines if you're having to push, so if you're constipated and it causes pressure, but also from pregnancy. So they're very common right after pregnancy from pushing during labor, but also obesity causing increased pressure due to the increased weight. Again, prolonged sitting. Even violent coughing or sneezing can induce those, but again, straining during bowel movements. Again, particularly if you're constipated, can lead to those. And that causes itching and bleeding from the anus. As far as treatments, warm baths, and then treating the constipation. So essentially treating what's causing the pressure. Diverticular disease, so diverticulitis, if you've heard of that. So diverticula, just a little background, are patches that protrude, so they're being shown right here. They protrude through the exterior wall of the large intestine. So diverticulosis or diverticulitis, this is when there are too many diverticula that are in the large intestine, and then if they become inflamed or infected, that's whenever you get the diverticulitis. You can also have irritable bowel syndrome. This is becoming more prevalent, so 10 to 15% of adults. Lots of different symptoms, so bloating and abdominal pain, diarrhea, opposite being constipation, kind of alternating between both of those, and even visible abdomen distension. So treating it, eliminating foods that kind of trigger that so that are not being digested properly, different dietary patterns, moderating caffeine, low fat meals are better, and then also decreasing, stress or treating depression that can cause this as well. Okay, so a dietary pattern that can be helpful for those with IBS is essentially decreasing fermentable carbohydrates, and that's just the acronym FODMAPs. These are different carbohydrates that can be fermented by the bacteria in your stomach. So if they don't get digested, those bacteria, again, they're still good bacteria, but they start working on those carbs, and it leads to bloating, gas, and diarrhea. So by eliminating those types of foods from the diet, it helps prevent those. So just some of the examples there. So eliminating foods such as wheat, onions, legumes, and different dairy for several weeks, and then gradually add that back so that you can determine which you tolerate and which should be avoided. Moving on to diarrhea. So this is just defined as increased fluidity, frequency, or the amount of bowel movements, typically caused by an infection of different microbes, malabsorption of dietary components, so like too much sugar or alcohol, excess fiber can also cause it as well. Treating it, preventing dehydration, having plenty of fluids, and then replacing those electrolytes that are being lost while the diarrhea is being or is removing those fluids. And then if it's prolonged, seeking medical attention. And it can be a serious danger for the two spectrums of our age. So for infants and elderly, it can cause extreme dehydration that causes lots of problems. Another issue in our GI system are gallstones. Again, about 10 to 20% of adults have these. This is showing a gallbladder with lots and lots and lots of gallstones in it. But this is the upper right kind of abdominal pain is where you would see this is, which is where the gallbladder kind of is. It also causes gas and bloating as well as nausea and vomiting. So typically it's treated just by removing the gallbladder. Another one is celiac disease. So this is a chronic immune-mediated disease. So our immune system becomes overactivated, and it's usually precipitated or caused by exposure to different gluten in the diet, typically genetically predisposed. Gluten is just found in different grains, wheat, rye, and barley, so pastas and that type of thing. It affects about 1% of the population, and what it does is it flattens the villi that help with all the absorption that stick out there. So now if they're flat, we have very little absorption occurring, so they're going to look malnourished because they're not absorbing all of the nutrients they normally would because their villi aren't working. And so the treatment is removing the gluten from their diet. And this is just showing, again, those villi we'd seen whenever we went through the GI system, but this is what they should look like. Again, this increases the surface area, just gives more cells to absorb the nutrients, but with celiac disease, they get flattened. So now, even though there's still some absorption, that's much less here compared to up here. So again, they look very malnourished and not getting the nutrients they need. And then finally, our non-celiac gluten sensitivity. So this is also called gluten intolerance. So this is where symptoms occur after eating gluten, but it doesn't cause the intestinal damage. So it doesn't flatten the villi like that we had just seen with celiacs, but it still causes issues when gluten is eaten. And that can be different GI distress. It can cause fatigue and weakness, headache, muscle pain, and joint pain, as well as sleep disorders. So again, it's not celiac disease. It doesn't flatten those microvilli, but eating gluten does cause these types of problems. So the treatment is the same though, so we're not eating gluten products.